Hello, I'm Karen Mon in the Department of Family Medicine here at the University of Virginia. I'm here today with Vicki Marsh, who has kindly agreed to be our standardized patient today. I'm here to demonstrate an approach to teaching the skin exam to medical students. And the technical part of teaching the skin exam is quite straightforward, really just helping the students assure good exposure so they get good visualization of whatever the skin concern is, and also having them know the technique to evaluate that appropriately. As experienced practicing physicians, pattern recognition is very important in how we make many of our diagnoses. But this is difficult for medical students as they haven't had as much clinical experience and they may not recognize many of the common patterns seen. So for them, it's important to have a methodologic approach to describing and diagnosing skin problems. As practicing physicians, when we don't recognize patterns of skin problems that are presented to us, we go back to the approach that we learned in our training. We ask a good history. We look at the distribution of the skin lesion or the rashes. We assure good exposure so we can evaluate it well. We describe the primary lesion. We make a differential diagnosis, and we may do some extra tests. We may do a biopsy. We may do skin scrapings looking for mites, or a KOH prep looking for fungal elements. We may do culture or gram stain, or we may do a Woods lamp exam. One of the challenges in dermatology is really that most patients, in fact most people, have some dermatologic abnormalities. So one of the keys is to help the student really identify these lesions as specific entities. In family practice, we're asked to do dermatologic exams in two basic scenarios. First, a patient may come with a specific skin complaint or a skin lesion for us to look at. And second, when we do our preventive health maintenance exams, we often will do a skin exam to look for signs of skin cancer or precancerous lesions. In both of these situations, taking a good history, evaluating the lesion well, making a differential diagnosis is important. Also in both of these situations, doing a thorough examination of the skin, especially areas that the patient can't see, may be important. In teaching the examination technique, it's important to help the student develop a methodologic approach so that they're really examining all of the skin. And this needs to be done, of course, with attention to the patient's privacy and comfort. For the purposes of this demonstration, I'm just going to examine one side of the patient. Often when teaching medical students, I'll have them start with the scalp exam. It's a place that they often forget to look. So make sure that the scalp looks healthy and that there are no skin lesions that haven't been previously identified. Then there's the examination of the face, and looking for specifically at areas of high sun exposure, places that you might see more sun damage. So the tip of the nose, the helix of the ears, the chin. Then look at the back and the buttocks, the chest, abdomen, good. And arms. Oops. Again, just making sure that you've got good exposure is helpful. Palms, good. And legs. Good. And bottom of the feet. Great. Okay. One thing you can do is have the student think about a three-step approach to observation. Sometimes standing back and looking from a distance is helpful in terms of giving information about the distribution of the skin lesions or the skin rash. Then stepping closer and looking at specific configuration of lesions can be helpful. And ultimately, a good examination of the primary lesion is going to give most of the information that will be helpful for the student to make their differential diagnosis. Looking at the primary lesion, it's important for the student to describe the shape, the size, the color, the primary characteristics of the lesion, its distribution, and other similar characteristics. The more opportunity the student has to practice their techniques of diagnosis and observation, the more facile they will become. You may want to investigate the glossary of definitions and terms that are embedded elsewhere in this system.